Family, good evening and welcome to the program Bodi Talk, where it comes to you every Thursday from 5 to 6 o'clock even time. Well, Bodi Talk na program where it comes to you from the Society for Radio Democracy 98.1 FM. And inside the program, we talk about different sickness, wetin dey cause am, treatment, prevention, and safe how signs and symptoms and self-prevention. As inside the program well Body Talk, we dey always get experts in at the studio for can talk about different sick them. And inside this edition of the program well Body Talk, we studio guest na Dr. Fedia Magdalene Bangali in at the Resident Family Medicine Department at the University of Salon Teaching Hospital Complex. And today inside the program well Body Talk, we dey talk about season sickness them, prevention, early signs and self home care. And where they bring this edition of the program well Body Talk, my name na Karifa to Conte. Remember say yourself can be part of the program by way I go send a comment or text message in our social media platform them na YouTube and Facebook or and self you go now 077981981 and later on with the open phone line also people will call the number 077981981 077981981 and the number where you go call later on at the program. As today we dey talk about rainy season sickness them, prevention, early signs and safe home care. And today I get with me Dr. Fedia Magdalene Bangali in a resident doctor of family medicine department at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program.
Good evening, Karifatu. Fambulem on a good afternoon. My name is Dr. Bangali. I'm glad for dinner today for me to talk to una about in season sick them, where we can get, and then how we go able for preventing sick them day. And the signs we go see for them sick then day and how we go able to handle them now.
Okay, so let's start first for look at wetin as the most common sickness them during the time of rain season.
So the sick that we can get commonly in a salon, we get malaria, we get typhoid, we get cold, what they can call common cold, and then we get diarrhea as well.
Okay, so let's look at then sickness there so one by one. Let's start with the one first when are the malaria. Well, let's look at wetin are some of the things where they cause the malaria sick.
Okay, so malaria na one body sick. We dey get from mosquito wey dem call the female anopheles mosquito. That mosquito dey get tumbu wey dem call plasmodium, and that tumbu dey if mosquito wey get that tumbu dey inside camp, e can bet you female mosquito. If e come, e can bet you mortal man. E dey left that tumbu dey na your body, and that body that tumbu dey multiply. We multiply na im dey cause the one body. And then that one body they can come with signs the way we they see. So the signs that we can see na the way body they act, you they get that bitter taste na your mouth, your body they warm. In your one body gets pattern. The body they warm for some time, then it cold back. Then your body they get you feel cold and then it cancel back. You also they get joint pain. And then if you left them when you not treat them, it can cause low blood, where we can see the pale. And then also it can cause convulsion, especially for picking them. Then it also can make for people them we can call them cerebral malaria. Then in like where the tumbu they go up the head and they make like say decrease.
Okay, so we get anything like typhoid, malaria.
No, typhoid malaria no dey. I think so over time people they don't use because typhoid in symptoms is similar to malaria in symptoms, and maybe over time when they don't they get treatment in hospital now it make people they don't commonly come up with that term the typhoid malaria. But every sick get immune and it better make you go to hospital they go check. May you know if really na malaria you get or na typhoid you get, because one body sick then they boku, it can be something else.
Plenty tell we don't hear people they talk about this jaundice malaria. What are the difference between this jaundice malaria and the malaria sick?
Okay, so this jaundice malaria we una dey talk na a complication of malaria. Like I say, where you can get malaria, you dey get then where your body don't warm, if you don't get am for long and then you not treat am, na in worsening signs na dem thing dem dey. E go and bulk your body, your red blood cells dey break down excessively, and then that your blood dey low. Another side effect again, you dey see your eye dey yala when na the jaundice wey the we people dey see. And then that jaundice dey you can get back the convulsion wey can come with am. All dem thing dem dey na a worse version of the normal malaria wey person can get with the one body.
Plenty tell we don dey hear you person dey say may the heart dey feel cold but don drink medicine na malaria dey mourn am but e no go na hospital. So wetin are the risks of people wey dey take self medication wey can feel some of dem signs dem dey wey you just mention?
Okay, I'm glad that you don't ask that question dey. So you dey make the malaria dey build resistance. The tumbu wey dey cause am over time, people dem don dey take medicine. The normal pattern wey people dey can do, wey dem don feel one body, dem no dey go na hospital, dem just dey go take malaria medicine because dem get the symptoms and the signs wey fit be malaria. So e can be say the person no get malaria, e don take am. E dey make that dey help for build resistance to dem medicine dem dey. Then the other thing back wey people dey can do, they can take the malaria medicine. It can be say yes, they get the malaria. They take the medicine after 2 days, where doctor go don prescribe am, then they not done am. So all that day your body dey build some kind of resistance, and then the malaria medicine over time, if people then continue that way, they e no go work as effective as e for be.
In line with that, dey also plenty time we don dey hear you wey person dey mention some of dem signs dem dey again. Say I dey feel cold, I get fever. Then he go tell you say, why go hospital na dem medicine dem give me, you sef buy and lay drinker.
Well, I should say we all know say na bad thing we dey do, and make people then lay for do them thing then dey. So going with the malaria, the thing that people they go able for do for help themselves instead of they prescribe for themselves na us. Make we try, because them mosquito then dey na pass stagnant water na dey they breathe, na dey they born them picking them. So if we declare we backyard and dispose of dirty and make water not dey sit down, now we also say we dey, or even them barrel themselves we okay open where the sit down where the water open, more they cover them, because if we left open down the back na stagnant water na water wey team up e no dey flow, e no get way for pass. So then gutter the whole can get we don't stock we go down dey for make water pass, make we dey clean am, that na way for make we help we safe. And then also we cover the drum them. We can also use spray, we can use mesh for cover we window them and we host them for make mosquito they know they enter. And then can government self the help with hospitals where they give them picking them. They can give them the under fives and they can give them anti-prevention also for them, and then for belle woman then self can get.
So how person dey able for differentiate between the common fever and self the malaria sick?
The common fever and then the malaria sick.
Yes.
Now we go na hospital and then you test, because like I say, malaria and typhoid and also even flu safe, they can get them similar symptoms. You join the heart, you mouth say bitter, you aid the heart, you dey feel weak, your body dey weak. All them things dey similar. The way you go able for do na for make you come hospital, make we can test you and know wetin dey do you, and then we'll give you the right treatment.
So why most times you don dey get plenty of cases them of the malaria sick during the term of the rainy season, as you just mentioned, na one part the common sickness them?
Yeah. So during rainy season, like I just don't say, then dirty the world it way we will not dispose of them properly, will not do proper waste management. It can make water dey sit down, maybe potholes, or then we can get them open the room them because one forget water rain they come, one get water now outside. We dey allow the water them for sit down, and where is sit down now the mosquito they born them picking them, we can call them breathing sites for them. Now then the mosquito lake. So now so that they boku, and where them boku, the more them boku, the more they infect we.
Okay, continue for the between at the program worker look at some of the common other common sickness that we just mentioned at the program. A name now Dr. Fedia Magdalene Bangali in the residence family medicine and Dr. na the department family medicine department na the University of Salon Teaching Hospital Complex. As today in the also for talk about in season sickness them prevention all in science and self home care. The program now will body talk it come to a live from the Society for Radio Democracy 98.1 FM. You self give me part of the program by why go send a comment or text message to the number 07798191 or self you go now Radio Democracy Facebook page. Later on inside the program we go open phone line. Also people will call the number 07798191 0779191 at the number where you go call later on and ask question but some of the sickness they will talk about the way mostly can affect people enduring the rain season wetin you want for know how for prevent yourself for making you not get that sickness then you go call the number and ask the question as we get the experts in the studio with we. Another common sickness we mention are the typhoid. So tell family about wetin a typhoid sick.
Okay. Typhoid back. Now other sick we can come with one body. But in one body, no can warm like how malaria they warm. So we can say it get low grade fever. But in your fever, it dey consistently. Like how malaria, where you go see say the body don't warm, then later back a cold for himself. In it can dey persistently. Then himself can carry with them joint pain the way we get. The tumbu wey dey cause am na salmonella typhi. And how we dey get that tumbu dey or wey dey carry inside water man body na through fecal oral route. That's na you get toilet, water man toilet wey get this salmonella typhi, toilet and then e no allow, e no dispose of that toilet properly like how e for dispose am, and then rain come. You get flooding and that flooding dey come dey with that toilet wey don dey outside and then e wash over and infect with fruits and vegetables all well. So dandy can cause that dandy and then person dey get am now.
Okay, so plenty tell we don dey hear but this typhoid sick say woulda get her that mean say the person don eat toilet. How?
And truly typhoid really na people dem toilet wey dey eat. So like I say na from fecal oral route. Person wey get the typhoid a toilet and then that toilet dey e no dispose of am properly. Rain come, that water dey can flood with that toilet the way they not don dispose properly and then e wash over. People that dey grow fruits and crop and vegetables around, that toilet dey go touch them fruits and dey dem body. Then you person you can take am, you take them fruit or you take that vegetable dey, you no wash am properly and then you put am na your mouth. Na toilet you don eat indirectly. So that na one way.
Okay, so wetin na the other way again?
Again, we well them back. If that flooded water back go inside well and then that well water dey don infected and then we take that water dey we not treat am properly, we drink am. Na another way than the way dey allow the typhoid to move for inside we body.
For people wey get well water na dem compound and maybe you no go know say the water wey don flood kind inside e get that kind of sickness dey. So how dem go able for treat the water wey dem go dey use for drink or cook?
So the best way na for make them boil the water before use. Na then they well body people dem master people, well body people dem we don do and it's done and we don see and say it's better. If you boil that water dey before you drink am or before use, it's better.
So what about the pump water?
It dey kill the tumbu.
The one they get from Guma.
So again, the thing is we don't know usai or how them pipe then they don't pass. Because we don't need bokuna, especially in Africa, them pipe then they maybe somebody go don't tap into them and it open some side. So I not go guarantee person say that water dey okay or you know okay. I not go know. But the best thing for make anybody go do now for make you boil water before you drink am, especially well water.
How fast the typhoid sick dey kill person?
So we can get where typhoid don dey na your body, and then you not treat am. And not this not to gear the people and say go dey go take medicine for typhoid.
Yeah.
But if you don dey na your body for more than 3 weeks or more, and then it dey multiply na your body, and then you not treat am, that tumbu dey can go sit down na your intestine, and when e sit down na your intestine, it can cause perforation, wey can lead to surgical case. Wey if that perforation dey not deal with am properly at that time, it can kill person, it can make you bleed, and then
For
lead to death.
listeners, wetin na the perforation?
Perforation na where you say you belle, that na you got the burst. So perforate in Creole mean for burst. So that tumbu dey go left for work at that site na you got where e don go sit down, and then e go left for work dey say dey burst, and then you the thing wey dey inside you got go scatter inside your belle. And how God make mortal man, wetin for dey na God for dey not for scatter. Na him make all thing dey na in your own part. When you don scatter, it can cause infection, and that infection dey na him quick dey kill person.
Okay. So we get other thing dem back wey people dey say if you eat chicken, you dey get typhoid. How true is it?
So probably dem no go don handle the chicken properly. So like I say, na from toilet wey infected with that salmonella tumbu, na im person dey get am. So maybe somebody wey infected with this typhoid don touch water or something wey infected with this toilet here wey infected, or water wey infected with this toilet don touch maybe a fruit or something, and then we handle there with food there, we no wash with hand, and then you take am, you handle the other food dem back wey you don get, e dey cause cross infection, and that is sef dey cause the typhoid. So really na proper handling of food can help with that. Na one prevention wey we can do.
So let's go to the other common sickness them during this rain season. The other one diarrhea we just mentioned. So wetin are the causes of dandy?
So first of all, diarrhea na rumbele. So wey the rumbele, water one, pass 3 times for the day, na im na dandy. Thing dem wey can cause am e vary, but na tumbu himself na from improper handling of food, and then that infection wey I don talk back per typhoid, wey person go na toilet, e no wash im hand, dey go touch food, e can give you. Na one way that the way person dey get infection wey dey cause that diarrhea dey. You get different type dem, but you get the acute watery diarrhea. Na one way wey person dey get am na wey toilet don go, you don person infected toilet water or whatever wey don reach you fruit or vegetables, or infect any food wey you get for eat, and then you take am into your body, and then it dey affect your body. So one thing wey I can say to people dem na hospital wey dey come, make dem we dey wash with food dem properly. Banana dem, people dey can dey eat banana so no, they no dey wash am. You no know whose water they use for nurture that banana dey. It can be infected toilet water. So because we all know see people that dey use manure for grow crops and then things like that. So you can wash that banana properly, and then before you eat them, you can peel your fruits them before you eat them. And then also, when we buy street food, more we watch around we. So sometimes you can go buy food, you dey see say you get kumbra, we get pikin, we dey per toilet under the table or near the table. Then that kumbra they sell food. You get for clean that pikin dey in toilet, and then when you clean the toilet, you not get soap and water for washing hand. And then they use that day, and it can infect your food, and they use eat them. So more they watch and be careful how they buy we food them, and then more they wash with hand before we eat, and we'll come on our toilet, make we wash with hand with soap and water.
So wetin are the symptoms of rumbele wey person no for ignore at all?
So rumbele in symptom, the main one wey dey na dehydration. That na where we body dey lost water. So mortal man, we body made up of 70% of water. If we lost that water dey, we body no dey function as how e suppose for function. But the early signs dem wey we can see from that dehydration dey na wey you mouth dey dry, you eye dey go inside, and then you dey weak because the body no dey work how e suppose for dey. We get thing dem wey dey inside electrolytes, we call them electrolytes. Wey dey lost dem, e no dey function, e no dey make body no dey function as e suppose for function. So dehydration na the most important thing. So wetin we people dey go able for do na host, na for as you notice say you begin get warm belle, make you begin take ORS. Again, under this same diarrhea, we get cholera. So cholera in your own way wey can come, e dey come with warm belle and vomit, but e dey kill very fast because in your own faster. E dey pull in your own rate at which you dey pull the warm belle, e very fast. One way wey dey differentiate cholera, in your own toilet, if people like wey you don take rest water, wey you don wash rest water, other water wey can left behind, e can look cloudy. So na so in your own toilet dey. So na one way that the way person dey identify. If you see that kind sign dey, do ya dey beg. Whilst you dey give the ORS, make you dey na road dey go na hospital. Not say you dey sit down na host for make that warm belle dey stop, because cholera dey kill faster than the normal warm belle wey we sabi.
Okay, so which type of then sickness say una can see more na hospital?
So na more of warm belle we can see. And another thing again for pikin dem your warm belle, maybe adults after we don take ORS, it can cut off on its own. For pikin dem, as dem begin dem belle begin run, do ya as you dey give dem the ORS, make dem dey go na hospital. Or sometimes again, we no kin know wetin can cause am. Sometimes dem pikin dem wey can malnourished, dem sef can cause warm belle, but their own treatment different. So the best thing I go tell person na for make e go na hospital if im pikin im belle begin run. For big person, you can watch after 1 to 2 days. If the warm belle no dey stop, then I can na hospital. One can know wetin dey do you, more treat you adequately.
For young pikin dem, especially the newborn dem, wey dem can toilet fast fast, plenty tell the hear dey say e dey clear im belle. How true is it?
Yes, dem can toilet, but like I say, wey pikin or wey you toilet water one, boku one pass. For pikin dem, maybe for toilet 3 times a day, it's okay. But water one, it's not normal than the abnormal. So you can watch them. If then the toilet, you don't dey know the normal usual pattern how for toilet. Some pikin the toilet 2 times for day, some pikin the toilet 3 times for day. If dem begin toilet pass that day, then you go know say something wrong. At that point, say you yourself go know say na belle they don't get. Then na for go to na hospital. Because most of the time themselves, the kumbare wey they can na hospital, they don't notice say my pikin, I 3 times for the day the toilet, but today don't toilet 6 times. So then self no say no normal. Do you always see that they can na hospital?
Okay. A name na Dr. Fedia Magdalene Bangali in the resident doctor family medicine department na the University of Salon Teaching Hospital Complex. And today inside the program Bodi Tok, we dey talk about in-season sickness them, prevention, early signs and home care. And remember, say you self can be part of the program by way go send you text message or question to the number 077981981, or self you go na already democracy Facebook page. Or later on inside the program, you go call the number 077981981, 077981981, and the number where you for call now and ask you questions about the topic where they do it today at the program. When are in season sickness, they waiting you want for know, waiting are some of the signs the way they get, or waiting are some of the kind way they feel, or how you want for take care of you at how you drink na also you go call the number 077981981, 077981981, and the number where you go call for ask question about the topic where they do it today at the program. So again, for picking them, how people go able, especially for comrade and go able for take care of them, picking them, mass a bottle or cup or anything where they drink with.
So we can advise them kumbaya then they say we then wash the picking them bottle with soap. Because the one thing where people they can forget, soap they pull boku bacteria, they kill they pull wash them off the surface of them thing their way the who they use.
Okay.
So soap or whatever it is where they cause the diarrhea, when they wash them bottle the way they wash them, you can keep them per hot water. That's na one way. Then another thing with mistakes where people they can do, where you don't handle your pikin in toilet, you change in pampers. Do ya once you handle with soap and water before you handle anything, we get for deal with the pikin eat one or with yourself.
Okay. Continue for day with me na the program. The program now will Body Talk and it come to live from the Society for the Democracy 98.1 FM. Now we dey take a break na the program.
Smartin, okay, okay, yeah. Baby, my rocks and do it already. Can't do it again. Them friends and see it already. Okay. See her with the man in the club and him a touch him friend. Talk about how him like you down back then. Bring up some story from way back when a wappy kill fill up on the three wise men. Does that talk same beat it? Film secret and I leak it. Better reminisce on the fun. Him can't get back money, my brox and do it already. Him can't do it again. Tell him friends and see it already. Him can't see it again. Them days that don't longer. You never come first and you never come last. Tell him run Allah. Never come first and you never come last. Hey, him not have nothing over you. Tell him get over you. Over you, him mama over you. From the day him discover you. Over you, feel insurance can't cover you. The payments overdue. Overdue is the next man all over you. Kiss and all over you. None of my brothers and do it already. Him can't do it again. Tell him friends and see it already. Him can't see it again. Them days they don't longer. Never come first and never come last. Tell him run Allah. Never come first and never come last. Some man use them out too much, and I use it for the wrong things. Run them out too much, so relations are not lasting. Use them out too much, and I use it for the wrong things. Run them out too much. Run it. Hey, none of my brothers and do it already. Oh Lord, him can't do it again. Tell him friends and see it already. Shout too much, him can't see it again. Them days they don't longer. Tell him run Allah.
The program now will Body Talk and it come to you live from the Society for the Democracy 98.1 FM. And where they bring to now this program, my name is Karifa to Conte. Remember, say yourself, give me part of the program by way go send a comment or text message to the number 077981981 or self call the number 077981981 077981981 at the number where you go call and ask question. But the topic we dey deal with today na the program when in season sickness stem when say get for nobody prevention, the early signs and self home care. As we don't talk about malaria, typhoid, diarrhea, and now we can look at common cold. Inside the program, I still get with me Dr. Fedia Magdalene Bangali, and the resident Doctor of Family Medicine Department na the University of Salon Teaching Hospital Complex. And today inside the program, we look at rainy season sickness them. So Dr. Bangali, let's look at now what's a common cold. When are the other common sickness them inside this rainy season?
Okay. So I go give him a general heading as cold first. Inside that cold day, you will get the common cold. This cold is a respiratory illness. That na sick the way they affect the lungs during rainy season. Then they not so just during rainy season, but they can more during rainy season. And why they more during rainy season? You get different tumble the way they cause then sick then they but mostly na viral cause can cause them. So whether the common cold or the flu, the influenza, na virus. Then virus then they can find it difficult for thrive, replace warm. So na im can make we no dey see am so no more during hot season. But when the place cold, e dey give dem virus and the temperature for make dem thrive in. So that way then now we able for get am. So one way person can get am na way person dey sneeze near you wey get this virus, or this person here wey get this virus don rub im nose. Rub im nose, e calm, e shake you hand, and you sef take am, you rub your eye, you rub your nose. The common thing wey we can see wey dem dey get the signs wey dem can get na dem nose dey block, dem dey run water, dem can dey cough. So for common cold im own symptoms milder, and then e no can start one time, e dey start small. So sometimes e go start your nose don block or begin run water, then later now e graduate to cough, then later now you can get sore throat. While on the other hand, the flu, in your own sometimes you go don dey in the morning, if normal one, and then you come in contact with this virus wey dey cause this flu ya, and you go begin get sudden one body, and the one body e dey one being not to that half and half or low grade fever, na high grade fever you dey get. You dey get am with this sore throat here, you cough, nose dey block, body dey hot, and then thing and so like I be mentioned earlier, flu in symptoms similar to malaria and typhoid. Na im make that na one reason why we for dey go na hospital, may we know, may the master well body people dem can tell you wetin do you and no treat na us.
Okay. So what again of people that wey dey drink pass and drink cold water continuously, then they also serve to make person get cold?
So like I say, this virus here, it dey thrive per na cold environment more than hot environment.
Okay.
So when you dey drink hot water, when you dey drink cold water, e no dey help. It just your body dey fight this virus. Most times your body can don fight this virus on its own. After 2 weeks, that cold can well if you not take nothing. But you taking the cold water can just worsen the symptoms where this virus dey give you. What you go able for do for help you safe? We can advise say make you take hot fluids, so you can drink tea, drink soup. It dey help for make then symptoms then the way you dey get from this flu, it can help for make you feel better because your body dey fight the virus. Taking the hot fluids can help your body for make help for fight that virus dey.
So what about the antibiotics there where people can take where normally can get flu and self cold?
So I know it's antibiotics na one thing where people they can tend for misuse. So I no go advise you for take antibiotic na us. Yes, you can get bacteria superimpose infection per that flu the way you don't get, or that common cold where that virus don't cause. And the antibiotics can tend for help you make you feel better. So people they can fit to say the antibiotic where you don't take now really they make the flu go away. But it can just help with the other thing that we sick that we can don't calm because your immune system not strong. The antibiotics can just help for treat the other sick that we don't carry inside where your body no well. So your immune system now is so jaman then your body where the help for fight sick the way they can your body. So I'm not going to advise person for take antibiotics. Can hospital.
So what of people who can normally can get that sore throat? You see they mix lem, diamint, then it gets other thing where they mix a drink can say for the sore throat.
Yes. Then they okay. Another thing where they can take for that day, then get this strepsil. Because you get this bacteria which can cause dandy, but I not advise because more not misuse them. People that they get antimicrobial resistance, that they take antibiotics left, right, any kind way, and then tango each way you really need antibiotics. They they work in your body like how your body for work. So your body cannot build resistance. You can take then other thing like the lemon get vitamin C inside. Some people they can suck vitamin C. Then they all they help for boost your immune system. And then when you boost your immune system, it they help for fight sick. So another thing is now the hot fluids, yes, I don't mention and the not to take antibiotics, just take the hot fluids and if you symptoms are worsen, can hospital. You can take paracetamol. Another thing we can help too, sometimes na ibuprofen, it can help with the swelling where they happen at tooth where they get the sore tooth. But not so all man capable for take ibuprofen because if you dey you get ulcer, it can worsen your ulcer symptoms. And one part the thing that we not fine for people that will get ulcer. So again, can hospital we can treat you.
So it's are the risk factor of people we can get persistent flu.
Persistent flu. Maybe you expose so continuous exposure to outside the flu the sit down. Then flu there can sit down per door handles, it can sit down per phone, or a day near person we get that the sick and then he sneeze or cough near you, you dey get so if your immune system not strong as well, maybe for people them we get HIV, them then soldier man then na them body you know they work as how normal people then you know soldier man na them body they work. So then they can then your sick can be worsened than how normal person go dey. So then go dey get persistently.
Okay. The program now will Bodi Talk and it come to you live from the Society for Radio Democracy 98.1 FM. You self can come be part of the program by why you call your number 077-981-981, 077-981-981 at the number where you go call and ask question about the topic where they do it today. When also they look at rainy season sickness, them prevention, the early signs and self-home care. The number for call now 077-981-981, 077-981-981 and the number where you go call and be part of the program. So let's look at talk and to the prevention parts. Waiting are some of the preventive measures them where people them for do for say no not get them common sickness I will just they talk about so now the program.
Okay. So I go start with the cold. If you know say you get this common cold, yeah, before you spread am to other person, you can wear face mask. So when you dey cough or when you dey sneeze, that water wey dey comot na you know so you dey go meet other person, make you no get room for travel far. But if you wan sneeze, you can take your hand, you bend your elbow and sneeze inside that your elbow dey. Then they go help for make that water wey you don cough wey dey spread too breeze make you no reach other person. And then wash your hands regularly for the common cold. You can drink a lot of water too. That's another thing we can help for make you feel better than into prevention. Going to malaria for people then we no go don join the start of this discussion. You can take then dirty they would keep now we compound around we area them where they allow water for sit down. Make we dey clean the dirty because then dirty then they way they day where then they where rain come that water the sit down within dirty then they and then they make the mosquito the born boku picking them day and breathing site for them and then they make them come infect we.
Okay.
Another thing we possibly can do, you can use mosquito repellents. You the rubber na your body, they get chemical there inside where they make mosquito.
We can look more into that and we don't get to first call on the program.
Okay.
Hello, good evening. Name and
Hello,
inside the call from.
how do you do, doctor and you didn't radio, let God bless you, let God guide me.
Amen, sir.
Okay. One thing I want develop that is considered then make that doctor that they blow. I want to put up their government, they create my out in this country, I will attack the country, so we don't pull up the country. And the more that doctor have for cow disease, cow some sick them. If they comply, then they create by the greater than this country, and all the best place for them. I hope since on the doctor, I will take go better for the small. But we have disease there, they have disease, I can't any radio, but we are not complete. Now do something, they create they avoid the city where all man jam there, the rob there, the bishop jam there, the rob there. Any day the doctor I go to get you. Any day they can get you for disease, for this, for that. That's all I do, Mama. I don't long talk. I beg Mama, let God bless you now.
Okay, thank you very much, sir, for that contribution in the program. The program now will Bodi Talk. It come to you live from the Society for Healthy Democracy 98.1 FM. Yourself can call the number 077981981, 077981981 at the number where you go call. Ask question about the topic where they do it today when are in season sickness them. We they talk about the prevention, the early signs and safe home care. Yes, Doc, you be talk earlier on the prevention.
Yes, so I will talk about mosquito repellents. Then get chemical inside where you can apply na your body, and then they can make them mosquito. They know it's done on your body for bet you. You can wear long clothes back, so you can wear long clothes cover your hand, cover your foot, and not give them mosquito them boko exposure of your body for make them bet you. We can put mesh then now we window them and now we demote them for preventing mosquito then for kind inside the house for can meat we and bet we. But above all, make we try me we know they get stagnant water then now we stand water them where they sit down and not get side for flow. You can use spray them back, them mosquito spray them, but what do you use them mosquito spray them? Oh spray them no sit down inside there. Give them time for make a done at the room before you go inside there.
So what about the one where they light the mosquito coil they inside there also?
So mosquito coil it gets a lot of allergens where if person will get asthma or we can be easily be allergic to them thing and they can bug them. Where you put light mosquito coil, do you not sleep on them? Put them if you able for tolerate them, fine. You can put her on and then hot time before you're ready for sleep and make it done at the room first before you're ready for sleep. Or not sleep a mosquito coil. You can use treated mosquito nets and cover yourself where you sleep. For malaria, then the thing that we can do for prevent
So for person we go buy or then get an hospital the mosquito net. So before in the engam. Wetin are some of the things they waiting for do first before you hang that mosquito net there?
So usually we can say make you put an ado because the chemical where they can don't use for treating mosquito net they can be strong. So if you put an ado person for make then that chemical they come on ado small make it evaporate and make you not just put on one thing. It can make person be allergic to them and then react, probably cough and sneeze and things like that to them, or it can affect person who get asthma. So if you put an ado, the sense can reduce and then you can go in.
The program now with Bodi Talk, it come to you live from the Society for Healthy Democracy 98.1 FM. Yourself can be part of the program by way go call you number 077981981, 077981981 at the number where you go call and ask question about the topic we do with today. Now the program when are in season sickness them, prevention, early signs and safe home care. So now look at the other preventive measures them for the other sickness them. So before that, we will look at the preventive measures them for typhoid, common cold and flu. Let's take this other call na the program. Hello, good evening.
Yeah, good evening, Parisha. How do you do? Yeah, thanks very much for what you do. Now just one few things. I know meet up the beginning, but I joined the organization. I know they talk about sickness than really benefits in the cause. And more are concerned for malaria because I want to end the more salon more. But I just one thing, I know say they don't stop the chloroquine treatment because of World Health Organization, they don't stop them. And I been believe they don't begin one when I assisting it. But I don't know, the other one been they want to prophylaxis, one like fancida. So I don't know how much they can advise people them for use them and how many months to use them before you take the next dose or when I get other prophylaxis, then get other prophylaxis treatment who then they give. And then also how much then they help for campaign, though na in they do so now in terms of releasing that to the government for letting them know. Because one thing they bring something they wanna fish them, wanna pond for each them got them of the anopheles, female anopheles. So I don't know how much that one they expand. But again, there was another program who I don't know if somebody go able voice and to government for remind them, then they spray. Then they spray the mosquito them around the areas of the sea and the rivers. That was the program. But during the war, then they stopped that project. But I don't know if somebody go read that one day and try to see how they will bring them back. Because now the only way that one day no more than go able to stop malaria. Because now for letting stop the female anopheles was in all day and there is no more malaria. But how they go able to do one, they therefore be a robust one. But I hope say doctor will take down there as a note. In case of anything we go meeting or we talk about big one, then they allege them, they go tell them, say, now so, we are not going to do so. So, but una, thank you for what they do, and let God continue to help una. Thank you very much.
Thank you very much, Uswed. Well, plenty thank you to Uswed from Manchester City, as himself don't make in contribution at the program. So, Doc, yes.
Okay, we want to say thank you to that caller day. So, if we talk about Fantida and how we able for use so the other medicine the way call, na medicine the way they treat malaria. So we get fancy that way they can use as preventive. Now they can give them belly woman them, and then they can give them small picking them na hospital. Fancy that can cover malaria for 3 months. But the thing about fancy that and waiting make the see and say people they don't use them so no more. You know we will use them past 2 years. So go use them for a long time. And also we area endemic of malaria, we live with malaria consistently. You go say they take down all through your life because them medicine there before that they left and so we for make we use, they can tell you the contraindications, how for use them safely. We not go and bug motor man. So now then they so we can use them more for them picking them and then belly woman them at that stage they because then your immune system not too strong for deal with malaria, so we can give them for that short time day of their life we then where the belly woman go dey per belly or where the pikin dey under 5.
Okay, so now look at the other preventive measures them for typhoid, the cold, and self the flu.
So for typhoid and then the wombele sick them. So at the start of with discussion, I be talk about typhoid C. We dey get through fecal oral route. Then we toilet person we get this tumor where they cause typhoid. He eats something where that toilet they don't go mix with water, and then he touch fruit or vegetable or food that we will not wash and then we eat them. I can now belly. So I remember one man day where I can see na TikTok. I don't know if na Mr. Smith. I can see some video. It can funny small, but it can go around the stop people that we want for toilet around Samba. Yes, I think Mr. Harold also. It can stop people that want for toilet around Samba Gota. I go give shout out to them because na good thing that they do. They help for prevent denting them way they promote typhoid around we. And we go expose other people then so then they people that go to toilet that na an example of improper management of waste in toilets, and then we in come it touch them toilets and then you don't go meet people them touch vegetables and infect them drinking water. So may we the handle with toilet properly, and then after toilet more wash we hand with soap and water. Then we also for cook with food them properly. If cumbra them commonly like I be say before, if you the handle picking toilets 2 hours you and before you go make chop for the picking or make chop for person for eat. And before you eat safe, always wash your hand with soap and water. May we dey wash with fruits there before we eat them, and then also peel the one them we able for peel. make that typhoid tumbu no can inside we body.
Okay. The program now will Body Talk. It dey come to you live from the Society for Radio Democracy 98.1 FM. You self can call the number 077981981, 077981981 at the number where you go call, ask question about the topic wey dey deal with today. Na the program wey na in season sickness. Wetin are some of the things wey you want for know? We dey talk about prevention, early signs and self-home care. As we don dey talk about the preventive measures them of the malaria, typhoid. So let's look at the preventive measures for people who can normally say I get cold.
Cold. Sorry, I just remember there's they get typhoid vaccine, but now private facilities they can get more.
Okay.
So you can check in our private facilities and see if you can get the typhoid vaccine. Yeah.
Okay.
So going to common cold, how we can
Before we look at common cold, more take this other call another program. Hello, good evening. The name and inside the call from.
Good evening. Constantine Kigani call Abacha Trisa.
Okay. Go ahead and
I
ask.
want to ask the doctor. But most of the way they taking come, or let me say 70% of population in this country are population sick. Let me say, you just and sick, but if people are sick, I don't be now. It starts for me with school. From school now, the next thing now, I joined to me to malaria. Me joined the week, I live in Easter. I live in the East. So I don't know what are the cause of sickness.
So you be go hospital.
No, I think what but I don't well. Now, native medicine I make. There's a bit of native medicine. Watching at the shop. So the medicine I use, I make garlic with lemon. They make woman bitter for me. You keep them for me. Buy, put it inside the stick. You pour them for just 10 minutes. Another baby, that garlic and lemon. So another baby, native medicine. That they prevent me from the malaria. So
Okay.
I'll let them confirm that for me back.
Okay, plenty. Thank you for that concern. That question the way asked na the program.
Yes, Kola. Thank you for that question, Dee. I know say like I be there. I wish it be for day at the start, so maybe go there here, but make the clarifications we it done the ask we, but so I say he's sick. He
get fresh cold.
He get fresh cold.
They get in body begin the atta.
No, I say begin get malaria.
Yes.
So like I've been say earlier, then cold symptoms, then can mimic how we dey feel we get malaria, the one body, the joints with the heart, and then thing and this. So most likely na flu. From wetin they talk, most likely sound like say na flu you go don get. And flu now you get tumbu wey can cause it can be of virus origin. It dey make your body dey warm, you joints the heart, you aid the heart, body dey weak. You still get the same kind bitter taste in some people then like how they get malaria, but e no mean say na malaria. So at the start, sir, I be talk say make when you feel the body dey warm, can na hospital, more can test you. Now when you test, now you dey know if na malaria you get or not. Do ya na for the car hospital. We dey na hospital and we ready for make we see to una problems and una dey carry it. So we dey talk about the lem wey e use. So lem and hot water na good thing na dey wey can help. Then wey dem dey wey dey feel wey that cold wey say you get the cold and then later it turn to malaria like symptoms. But na how you dey feel na you dey say malaria. I no wan for use malaria because me sef can try for tell me patients and make them talk how they dey feel. So maybe in joints go down the heart in body dey warm in the heart, then kind thing and dey. It can help with body for make we fight the tumbu wey dey cause that cold like symptoms the flu. So vitamin C fine. Next time again you can drink hot water, you can drink soup. It dey help for make your body strong. It dey help your body for fight that tumbu wey dey cause that cold there.
Sort of people wey can get cold like they be ginger, garlic.
Yes, they all they help your immune system. It help your immune system for fats then thin them. It's okay.
So this now in season, how them cable for prevent themselves from cold.
What do they do? Now for you can cover yourself properly with clothes, and then try for the wash you hand regularly, because if you go touch something where that virus stay don sit down palm, more say phone, or you shake hand with person, or you hold door handle and then you use that touch where you don't touch am, that virus stay don kinda you hand, then you sef take that virus dey, you rub your eye, you rub your nose, you don dey expose yourself to that virus for make e inside your body. So na that dey make e important for wash you hand. And then they take hot fluids as well regularly during the cold term. Like I say, that tumble wey dey cause the flu or the cold, e no like thing wey warm, e dey thrive more or e dey live longer na cool environment.
So if I'm for rub the hot rub there.
So then yeah, then thing and they all just dey help for help with symptoms dem wey we dey get. Maybe the hot rub can help for the congest your nose wey don block or wey dey run. That need all na symptoms the way they get from the cold and the flu. So it's fine for make you rub am. You can get them mentholated inhaler them. The menthol wey you dey inhale am can soothe your respiratory tract and help with the symptoms the way they get. So it's fine.
So now you can left at the studio waiting at the health message where you go left to people them out there during this rain season.
Do ya me people them are they big where you belle they run, you can take ORS. But if you still say the run belle no they stop, do ya can hospital. Run belle they kill fast if you not treat them. And then make who get we one body them, make we not dey land for just go take malaria medicine or antibiotic anyhow. Can hospital more can treat una, more can check, we do test, we check and know exactly wetin dey do you and give you the right medication for you sick.
Okay. Plenty thank you for joining at the program. In name now Dr. Fedia Magdalene Bangali in the resident Doctor of Family Medicine Department na the University of Salon Teaching Hospital Complex. As today inside the program we will talk about rainy season sickness them, the prevention, the early signs and self the home care. Plenty thank you for joining at the program and self. Plenty thank you to the one that we call, ask questions, and well now we'll end the program for today, Thursday, July 16, 2026. Plenty thank you to me producer Musa Kamara, DJ Madi for in technical support. Mary Kamara Bangwa make una watch me live now social media platform them. And me present this edition of the program with Bodi Tok. My name is Karifa to contact say. Don't forget for listen next week Thursday as we get another set of topic again. We'll go look at all our sickness that we can talk about waiting people for no but then sickness and they and how for prevent them. No, and Mina Kaifa to contact